Right now, the coronavirus continues to spread here in the U.S.
More than 150 people now have the virus, and now 11 people have died. Now, 10 of those people were in Washington state, 1 from California. Now, federal authorities are working to figure out why Washington has been the epicenter for coronavirus cases right here in the U.S. Just to reiterate, there are no confirmed cases of coronavirus right here in our state, but according to the State Department of Health and Human Services, more than 200 people are now being supervised for the coronavirus.
13 Action News anchor, Nina Porciuncula is live from the Southern Nevada Health District this morning with how state officials are planning to keep you informed moving forward. Nina, good morning.
Good morning, Ross and Kalina. Nevada's health department will now begin posting weekly updates on its efforts to monitor coronavirus in the state. It actually began posting on Tuesday on its website. So let's take a look at that website right now. So you're going to see in this post, it has the number of persons under investigation, individuals under public health supervision, also known as persons under monitoring and confirmed cases. So 14 people have tested negative for the illness so far, and those under supervision are not showing symptoms, but have been in contact with someone who traveled to an impacted region. Again, we have no confirmed cases of coronavirus in the state. Now, according to the CDC, coronavirus cases are likely to be identified in the U.S. in the coming days, and it is likely that person-to-person spread will continue. But in a press conference last week, Nevada Governor Steve Sisolak is hoping to ease worries, emphasizing the importance of staying informed.
As UMC stated just the other day, the antidote to fear is knowledge and preparedness. So that's what we're going to do. We're going to prepare, not panic.
Now, starting next week, that's Thursday, March 12th, the state's health department will begin posting those weekly updates every Thursday at 5 p.m. That's going to be on their website. That's also posted at the bottom of your screen right now. That address is dpbhn.nv.gov/coronavirus. So you can check back for updates every Thursday, again, every 5 p.m. For now, reporting live, Nina Porciuncula, 13 Action News.
Resources in the fight against the coronavirus. More than $8 billion of emergency funding is now available to fight off a potential outbreak here in the U.S. So far, 129 cases of COVID-19 have been reported across the country, and 11 people have died from the virus. California has declared a state of emergency as the first death has been reported in the state from the virus. The other 10 deaths occurred in Washington state. The funding for the coronavirus is much more than President Trump originally proposed. Well, no reported cases of coronavirus here in Clark County, but first responders are still taking precautions.
And tonight, 13 Action News anchor Nina Porciuncula explains what first responders here in the Valley are now doing to stay safe and also prepare for the coronavirus.
As the coronavirus continues to spread, Nevada is one of many states that remains free from confirmed cases. But Clark County Fire Chief John Steinbeck says he's been preparing for the virus's impact here since the first reported case in China.
We saw this with H1N1. We did. And we're taking the same precautions.
CCFD is taking a proactive approach.
We, of course, have had to get more of that personal protective equipment so that we can protect our people and not have our people be carriers throughout the rest of the community.
That includes eye protection, masks, and gloves. Equipment are all thoroughly disinfected, but that's not new. This is all standard procedure. For the coronavirus, CCFD has added an extra step. After we have somebody that might fall into that suspected category, it may come back after a couple of days that that person's been identified with the coronavirus, and then we would have further evaluation of our people to make sure that we're not going to then spread that to anybody else. That's why CCFD has a so-called continuity of operations plan, a plan B, so it'll be able to continue to provide services even if a number of its own workforce gets sick. But this is only the worst case scenario. Right now, Fire Chief Steinbeck emphasizes preparedness is key. If we were to have an earthquake, if we were to have a large-scale power outage, a lot of different things, those preparedness efforts are the same all the way across the board. Understand who's going to take care of your kid if you're sick. Understand who's going to take care of your animal if you go into the hospital for a little while.
We are announcing the first presumptive case of coronavirus in our community. This is a Clark County resident. His test is considered what is called presumptive positive, which means that he's confirmed by our local lab here in Las Vegas, but still it needs to be confirmed by the CDC lab. This is a male, over 50 years old, and he's admitted at the local hospital. This person traveled to Texas and the state of Washington within 2 weeks before the onset of symptoms. He has a child in a school that we already, the child is asymptomatic. We already gave the instruction it's not going to school. We are working very closely with the school district on this, sharing information, and they already are aware of that.
Our patient is in airborne isolation and does have an underlying condition. We're hoping for the best outcome for this patient. We have not identified any community spread at this time, and we're working hard to notify all close contacts that may have been exposed to this patient. Those that have had exposure are being asked to self-quarantine, and we're assessing for symptoms.
We're going to begin 13 Action News Live at midday with that breaking news. The first case of coronavirus has now been reported in Nevada, specifically here in Clark County. The Southern Nevada Health District just wrapped up a briefing on this coronavirus case moments ago.
So here's what we know so far. A man in his 50s is currently hospitalized in isolation. He recently traveled to Washington State and Texas, where we do know there have been some cases of that virus reported in Texas. And then, of course, we do know that 10 deaths have been reported in Washington State. Now, the health district here briefing the public on the patient we have locally, who is from Clark County.
And we have 13 Action News reporter Jeremy Chen live with the latest from those local health officials. Jeremy, what can you tell us?
Well, Kalina Ross, as far as that particular patient, yes, he is a Clark County resident, and health officials are saying he and his family right now are staying at home as we speak to try to prevent the spread of COVID-19. Right now, what they're looking at is that this patient is a presumptive case, meaning that they actually took some sort of local tests here to determine whether or not he had COVID-19, and then they're going to send the samples over to the CDC for confirmation that he indeed has COVID-19. So right now, it's just a presumptive presumptive possibility that he has COVID-19 at this point. Now, as far as the patient himself, we know he is a man in his 50s. He has had a recent travel to Texas and Washington State. Of course, Texas is the location where we had our first travel-associated case of COVID-19, and Washington State, where we have that outbreak at that nursing home occur over there, where quite a few cases have broken out through community spread. Now, as far as whether he traveled anywhere else, especially outside of the United States, that is under investigation at this time, according to the health district. But right now, he is hospitalized. As far as his condition, the health officials did not make that clear as far as his particular condition. However, they did say he was suffering from breathing issues still at this point. Now, as far as for residents here in Clark County, the health district wants to stress that the possibility of transmission remains low here in Clark County. They're doing everything they can to isolate this presumptive case of COVID-19 here in Clark County. They also want to stress there is no known cases of community spread here in Clark County at this point. They also want to make that clear. So this is what we know right now about that. Of course, if we do get any more details, we'll be sure to share that with you on air and online. For now, back to you, Kalina and Ross.
You know what, Jeremy, you've been covering this for us for quite some time. You've been out and about around our area here. What's the vibe been like? I know you mentioned earlier that you were at a Costco and you saw the long lines and some of the items missing. So can you just speak on that a little bit?
Yes, earlier this week when I was actually doing shopping on my day off, I actually went to a bulk store, Costco, and I noticed that there were quite a few people just buying pallets of water. Almost every single car you could see someone buying water, and when you went inside the store, you would actually notice there were no more waters left, and when they got a new shipment, the employees pretty much just had to tell everyone to get in line, put a limit on how many cases each Costco member could actually buy, that limit being 10, and people were were literally buying 10 cases of water each time. There was also pretty much no toilet paper to speak of at Costco particularly. That was what was happening at the big box stores. If you went to like a Smith's or an Albertsons, that wasn't necessarily the case. However, if you're talking about hand sanitizers at places like pharmacies or Smith's or Albertsons, they were running low on those supplies, at least as far as the stock on the shelves. So certainly people are being aware. Quite a few people buying lots of water, buying lots of toilet paper. As far as the doctors here at the Southern Nevada Health District, they are encouraging people not to do that. They actually encourage people to instead take preventative hygiene measures. Wash your hands. If you happen to be sick, do not go to work, do not go to school, stay away from everyone else. Pretty much just stay in your bedroom if you actually need to. Those are probably the two main things they want to stress to people here in order to prevent the spread, especially of any sort of disease, especially of COVID-19. Kalina?
And Jeremy,
thank you so much.
Yeah, I was just going to say, I know one more angle that you've been covering is just how our institutions here in Southern Nevada have been getting ready, places like hospitals, as well as businesses, and especially schools. I mean, so many kids and people working in our schools here in Southern Nevada. How specifically are schools getting ready for this moment? Again, a potential case of a presumed positive case of coronavirus here in Clark County.
Actually, it was a good thing you mentioned that, Ross, because according to health districts here, that particular man apparently does have a child that does attend school, whether it's a private or public school, that is not known at this time. But that child was told to not go to school today. Now, as far as schools themselves here in Clark County, we did reach out to CCSD last week just to get an idea of what protocols they have in place. They do say they are monitoring the situation. They're working with the Southern Nevada Health District to inform parents of what to do in case this were to happen. As of right now, they're pretty much doing the same recommendations the health officials are telling people. Do not pretty much stay away from school, whether you're a teacher or a student, if you have some sort of like flu-like symptoms or symptoms that are similar to COVID-19 in order to prevent the spread. And also, again, wash your hands, wash your hands. That seems to be kind of the prevailing advice, whether it's been here in Clark County or anywhere else around the world. They also want to mention, especially, when you have little kids, they might like to touch a lot of surfaces or maybe touch their faces or anything like that. They also want to stress to parents, like, tell your kids, especially if they are sick, if they were to sneeze or cough into their hands, first of all, don't cough into their hands. And also, second, don't take that hand and start rubbing their face, using that hand to rub their face all over, because that could easily spread any sort of disease, whether it's the flu or COVID-19. So that's another thing schools have been mentioning. Now, as far as universities and schools, UNLV has actually canceled their study abroad program. They canceled their programs in both South Korea and China. In fact, they had some students in China back in January. They were able to get those handful of students out, and thankfully none of them showed any sort of symptoms related to COVID-19. At Nevada State College, they actually sent a letter informing people, just be aware, again, wash your hands, stay away if you are sick, but also, just be aware that this particular disease does not inflict one particular set of people or anything like that. They also wanted to discourage any sort of xenophobia, to put it in perspective. And also at Touro University, they're also developing their own plans just in case the coronavirus were to spread somehow here in Clark County. So a lot of institutions monitoring the situation and keeping tabs on the situation.
All right, Jeremy, thank you so much. We'll check back with you in just a little bit. I do want to go back to the press conference, though, for just a second, because we did hear from disease surveillance supervisor there, Kimberly Hurton, and she was very, very firm in saying that this person, the presumptive first coronavirus case here in town, did take a flight, however, did not have any symptoms on that flight.
Right.
Now, there were a lot of questions from reporters. They're asking, well, what does that mean? Do we still need to be concerned? And she was saying there's kind of a procedure. So if someone were to show symptoms on a flight, they then contact the surrounding area, specific surrounding area, and then either local health officials here, if that person ends up being here or somewhere else, will go ahead and go through the process of contacting them specifically. But again, She mentioned that this person who is now our presumptive positive case here in town was not showing any symptoms on that flight. Of course, we're still waiting from the CDC to confirm that positive test result that we have here locally. They mentioned in the press conference they could take anywhere from 24 to 48 hours, so we should have our answers soon with regards to this case.
But they said that they are fairly confident that their own testing here in the local lab did come back positive for coronavirus. So that's why they have this man who is in his 50s again, who has tested presumptively positive for coronavirus in quarantine. Airborne isolation is how they termed it. And also, like you mentioned, really what the health district is doing at this point is reaching out to anyone who this man may have come in contact with over the past couple of days, just to see if they've been suffering any symptoms, to get them tested, and to make sure that there is no community spread. Again, at this point, there is no community spread here in Southern Nevada. This is the only presumed positive case that has tested positive here in Clark County.
You know, and they did also say that that hospitals and doctors' offices can sit here and request for you to be in isolation if they think you have any symptoms, even before a positive test result could come through. So that's something that everyone is just kind of looking like we're taking precaution. Not only can we take our own precautions, like Jeremy mentioned, washing your hands and just being safe. If you have the flu or if you feel sick, stay home. But also just globally, the extra effort everyone is going through to make sure everyone stays safe. You can really feel it. So we'll have to continue to track that for you all morning long here.
And if I could just add one thing, the health district is encouraging people, if you think that you may have come in contact with someone or are feeling any symptoms associated with coronavirus, do not go to the emergency room. That's what they've been saying. Really, you should reach out to your primary care physician to just tell them what you're feeling, what's going on, and then they can potentially do that test locally, because they want to reserve those emergency beds for worst case scenario in case they need to isolate someone at the hospital.
Exactly.